If you're pregnant, there are some mistakes nobody warned you about. And here's the surprising part. Some of the biggest mistakes aren't the obviously reckless things. They're the things pregnant women do because they're trying to do everything right. Eating more because you're eating for two. Googling every little symptom because you want reassurance. Comparing your ultrasound to somebody else's ultrasound because their baby measured differently. Buying a supplement because the bottle says natural, or spending 9 months trying to have the world's most perfect pregnancy. So today, we're talking about 10 common pregnancy mistakes and what to do instead. And stay with me because when we get to number 8, we're talking about something especially close to my heart: ultrasound. There is one mindset around ultrasound that can turn what should be helpful information into a whole lot of unnecessary anxiety. And after nearly 20 years in ultrasound, I've seen it happen again and again. Hi, I'm Nancy Culp, RDMS, also known as the Prenatal Paparazzi. I've spent nearly 20 years working in ultrasound, and I'm also mama to 4 grown humans, so I've experienced pregnancy from both sides of the ultrasound machine. Professionally, I've seen thousands of those little flickering heartbeats, tiny hands, wiggly feet, and very stubborn babies who apparently did not get the memo that we needed a particular picture. And personally, I've been the pregnant mom wondering what's normal, what's not, whether every weird sensation means something. That's why my goal here isn't to scare you. It's to help you feel educated, prepared, and empowered to ask better questions. And because early pregnancy can come with a lot of uncertainty, I created something to help you through that stage. It's called Welcome to Your Early Pregnancy Ultrasound Guide. And I'll tell you more about that in a minute. But first, let's start with mistake number 1. Eating for two. You've probably heard this one. Go ahead, you're eating for two. And suddenly your baby has apparently requested an extra large pizza, fries, and dessert. Here's the problem. Pregnancy absolutely changes your nutritional needs, but eating for two doesn't mean you need to eat twice as much food. Instead, think nourishing for two. You're supporting your body while it's doing something extraordinary. Your healthcare team can help you understand your individual calorie and nutrition needs because those can vary based on your health, starting weight, activity level, pregnancy stage, and whether you're carrying multiples. But here's the practical takeaway. Don't obsess over eating more. Think about getting more nutritional value from what you're already eating. Protein, fruits and vegetables, whole grains, healthy fats, and whatever foods you and your healthcare provider determine are appropriate for your pregnancy. And if you're in the first trimester thinking, Nancy, vegetables sound disgusting. I'm currently surviving on crackers. Welcome to pregnancy. Sometimes the goal isn't perfection. Sometimes the goal is simply getting through the nausea while staying in communication with your healthcare provider. Which brings us perfectly to mistake number 2. Not drinking enough water. Hydration sounds boring. Nobody throws a gender reveal for drinking enough water. But hydration matters during pregnancy. And pregnancy can make it surprisingly difficult. Maybe you're nauseated. Maybe plain water suddenly tastes terrible. Maybe you're avoiding fluids because you're already going to the bathroom every 12 minutes. Your bladder right now basically is saying, I don't care that you went 5 minutes ago, we are going again. But instead of waiting until you're extremely thirsty, make hydration something you think about throughout the day. Carry a water bottle. Try cold water if that's easier. Try adding pregnancy-appropriate flavor if your provider says it's okay. Pair drinking water with habits you already have. And if vomiting is making it difficult to keep fluids down, that's a conversation to have with your healthcare provider. Don't make yourself miserable trying to tough it out, which brings us to mistake number 3. And this one, almost everybody with a smartphone has done it. Googling every single symptom. It's 2:13 in the morning, you feel something weird, so you grab your phone and you type, 7 weeks pregnant, weird pulling feeling left side normal. And 15 minutes later, you've somehow convinced yourself you have 17 rare medical conditions. Does that sound familiar? Information is helpful, but unlimited information without context creates enormous anxiety. Pregnancy symptoms vary. Some symptoms are common. Some deserve a call to your healthcare provider. And Google cannot examine you, review your history, or evaluate your pregnancy. So instead of asking the internet, is this normal? Start asking, is this something my healthcare provider wants to know about? That's a much better question. Use reputable educational resources. Learn about pregnancy. Ask questions, but don't let late-night searching become your substitute for individualized medical care. And while we're talking about the internet, number 4, comparing your pregnancy to everyone else's. Your friend was nauseated at 5 weeks, and you're not. Your sister showed at 12 weeks. You're 15 weeks and barely showing. Someone online heard a heartbeat at one appointment. Your appointment happened at a different point in pregnancy and looked completely different. And suddenly you're thinking, something must be wrong. Not necessarily. Pregnancy isn't a synchronized event. Bodies are different. Babies are different. Dates can be different. Symptoms can be different. And early pregnancy especially can change dramatically over relatively short periods of time. This is something I wish more pregnant women understood before their first ultrasound. You may walk into an ultrasound with a picture in your head of exactly what you're supposed to see, and if reality doesn't match that picture, anxiety can immediately take over. But ultrasound findings need to be interpreted in context. That's why your individual healthcare team matters. Your pregnancy isn't behind because somebody else's TikTok pregnancy looks different. You are not competing in the pregnancy Olympics. There is no gold medal for showing first, having the strongest symptoms, or having the most Pinterest-worthy bump. Number 5, skipping prenatal appointments because you feel fine. Here's another easy trap. I feel great, so everything must be fine. Feeling great is wonderful, but prenatal care isn't only for when something feels wrong. These appointments allow your healthcare team to monitor you and your pregnancy over time. And some things deserve attention don't necessarily announce themselves with dramatic symptoms. So go to your recommended appointments, ask questions, tell your provider what's going on, and before an appointment, write your questions down. Because pregnancy brain is real enough that you can spend 3 days thinking, I have to remember to ask this. Then your provider walks in the room and suddenly your brain contains absolutely nothing but elevator music. Keep a note on your phone and add questions when you think of them. Then bring that list. Number 6, assuming natural means safe. This one is important. A product says natural, herbal, organic, plant-based, and our brains sometimes translate that into safe during pregnancy. Those aren't the same thing. Supplements, herbs, teas, medications, and other products can have effects during pregnancy, and what's appropriate can depend on your individual situation. So don't assume something is safe simply because it's marketed as natural. Before starting medications or supplements, or stopping prescribed medications, talk with your healthcare professional. This is one of these areas where a 5-minute conversation can save you a lot of uncertainty. Now, let's get to one of the most important mistakes on this entire list. Number 7, ignoring your body because you don't want to bother anyone. I want you to hear this clearly. If something concerns you, you are allowed to ask about it. Pregnant women sometimes minimize symptoms because they don't want to seem dramatic. They think, I'm probably overreacting, or I don't want to bother the office. Maybe I'll just wait. Your provider would rather you understand when they want you to call. Ask your healthcare team ahead of time. What symptoms do you want me to contact you about immediately? Get clear instructions specific to you. And symptoms such as significant bleeding, severe pain, trouble breathing, fainting, severe headache, vision changes, fever, or other concerning or rapidly worsening symptoms warrant prompt medical guidance. Later in pregnancy, concerns about your baby's usual movement pattern also deserve attention. If something feels urgent, seek appropriate medical care rather than waiting for a YouTube video or Dr. Google with when to get professional care. It shouldn't replace professional care. Now, let's talk ultrasound, because this is where the prenatal paparazzi gets especially excited. Number 8, treating your ultrasound like a pass or fail test. For many parents, the ultrasound is one of the biggest moments in pregnancy. You've been waiting, you're nervous, you're excited, you're lying there thinking, tell me everything is okay. And I understand that. But here's what I want you to know. An ultrasound is a medical imaging examination, not a pregnancy report card. Different ultrasounds are performed for different reasons and at different stages of pregnancy. What can be visualized depends on many factors, including how far along the pregnancy is. And sometimes, baby simply does not cooperate. I've had babies tuck themselves into positions where you would think they were intentionally avoiding the paparazzi, which, considering my nickname, I take personally. Excuse me, tiny human. The prenatal paparazzi here. Could we please see your face? Nope. Hand over face, back turned completely unbothered. But seriously, one of the biggest things I want parents to understand is that one image without context does not tell the whole story. And this becomes especially important in early pregnancy. If you're approaching your first ultrasound thinking, what am I supposed to see? When should I see it? What happens during the appointment? What if the dates don't match exactly what I expected? Those are exactly the kinds of questions that inspired me to create my Welcome to Your Early Pregnancy Ultrasound Guide. It's designed to help you walk into that experience feeling more informed about the process and better prepared with questions for your healthcare team. So if you're in early pregnancy or know someone who is, download Welcome to Your Early Pregnancy Ultrasound Guide using the link below. Think of it as having a little prenatal paparazzi preparation before your appointment. Not a replacement for your doctor, not a diagnosis, a guide to help you understand the experience and advocate for yourself with better questions. Number 9, forgetting that mental health is part of pregnancy health. Pregnancy isn't only physical. There can be excitement, fear, joy, stress, uncertainty, sometimes all before breakfast. And there's a strange pressure to be happy every second because you must be so excited. You can be excited and overwhelmed. You can be grateful and anxious. You can want this pregnancy deeply and still have difficult days. If anxiety, sadness, intrusive thoughts, panic, or other emotional changes are becoming persistent, intense, or interfering with daily life, talk to your healthcare professional. Mental health is health. You don't have to wait until things feel unbearable before bringing them up. And please, don't compare your emotional experience with the highlight reel you see online, because that leads directly into our final mistake. Number 10, trying to have a perfect pregnancy. This might be the biggest mistake of all. Trying to do pregnancy perfectly, perfect diet, perfect exercise, perfect nursery, perfect birth plan, perfect bump pictures, perfect reaction at the ultrasound, perfect everything, except pregnancy is a human experience. And human experiences are messy. You may have days when you eat beautifully and days when the only thing your stomach can accept is toast. You may have days when you feel energetic and days when putting on pants feels like an unreasonable request. You might cry because you're overwhelmed. You might cry because you're happy. You might cry because somebody ate the snack you were saving, and frankly, that last one may be justified. Your goal isn't perfection. Your goal is to stay connected to qualified care, learn what you can, ask a question, pay attention to your body, and make informed decisions with your healthcare team. That's it. You do not get extra pregnancy points for suffering silently, and you don't lose pregnancy points because you asked a question. So what should you do instead? If I could give you a simple pregnancy game plan, it would be this. Stay connected with your prenatal care team. Ask questions. Keep your appointments. Be thoughtful about what information you consume. Don't automatically compare your pregnancy with someone else's. Don't assume natural means safe. Learn which symptoms your provider wants to call about. And remember that ultrasound is one piece of your prenatal care, not a pass or fail exam. Most importantly, give yourself permission to learn as you go. Nobody wakes up with a positive pregnancy test and magically knows everything about pregnancy. You learn, you ask, you adjust, and that's one of the reasons I'm here. I'm Nancy Culp, RDMS, the Prenatal Paparazzi. After nearly 20 years in ultrasound and raising 4 humans of my own, my goal is to take some of the mystery out of pregnancy ultrasound so you can replace some of that fear with useful information and better questions. And if this video gave you one "I didn't know that" moment, here's what I'd love for you to do. Like this video, subscribe, and share it with another expecting mama for more pregnancy education. And if you're preparing for an early pregnancy ultrasound, I've created something specifically for you. Download my Welcome to Your Early Pregnancy Ultrasound Guide using the link in the description below. It will help you better understand what to expect, what questions you may want to ask, and how to walk into that appointment feeling more prepared. Because pregnancy comes with enough surprises. Understanding your ultrasound shouldn't have to be one of them. I'm Nancy Culp, your prenatal paparazzi, and I'll see you in the next video. And until then, stay curious, stay informed, and don't be afraid to ask questions. Your healthcare team has the medical care covered. I'm here to help you understand what you're looking at along the way.